Well, my name is Ann Laporte. I am a nurse. I've been a nurse for about 35 years. I have a 29-year-old daughter who I love spending time with, and I am the fourth of six children. So I come from a very tight-knit, big Italian family in New York. I've done a few marathons, I've done some triathlons. I have cycled 50 miles a day sometimes 6, 7 days through Europe. So we like to travel on bike because you see so much more when you're out in nature. Well, I did have some screening CTs where they did find a single pulmonary nodule back in 2009. So they followed me for 3 years. They said, there's no possible way this is cancer. You're a lifelong non-smoker. We're not going to track you anymore. But it was always a little bit in the back of my mind because as an endurance athlete, I'm very sensitive when things change in my body. Um, I told you about my daughter's diagnosed with Hodgkin lymphoma. So I think after that period, I kind of went off the radar. I was working, I relocated to California because my daughter moved here, and I started noticing back pain. So I went to a physician in March and it was getting progressively worse. I had gone to 4 or 5 different doctors in the ER twice before they finally agreed to do an MRI of my back. Up until that time, I thought this might have been related. I was still biking and running and swimming quite a bit, so I thought I had a sports injury. But to my shock, I had very advanced metastatic cancer throughout my spine. This was diagnosed by an ER physician because my second trip to the ER, where they wanted to send me home with ibuprofen, I said, this isn't about ibuprofen. I had already been on it for about 7 months. So yes, it was a devastating diagnosis. It was very frustrating. Like my first visit to the ER, I just begged for a chest x-ray, but I was well aware that if you have a lung cancer and it's smaller than a centimeter, it's not going to show up on a chest x-ray. I also noticed that my CBC was abnormal, but I had a normal white count. So I asked the doctors, why do I have this very unusual differential? And they all said, no, it's not a problem. So what I found, honestly, is that there's a huge lack of experience or knowledge about the latest research in lung cancer, because I almost felt like the physicians I was dealing with on the day-to-day basis were very unfamiliar with all of the research happening in lung cancer. And when they told me that there was no possible way, I said, one of the fastest growing groups getting lung cancer are non-smoking women. And I was never listened to, and it was very frustrating. Sure. So when I left the ER that day after my back MRI, I was diagnosed with stage 4B non-small cell lung cancer. The tumor in my lung, my right upper lobe, is about 1.4 centimeters, so not a large tumor considering the amount of cancer that's in my body. So I already have metastasis throughout my spine and my liver and my lymph nodes. So it's really, the worst case scenario. So I hope I can be an advocate for early screening. That blood test that I did that showed my lung cancer mutation seemed so simple. When you have a disease as catastrophic as lung cancer, you don't want any delays. I could barely stand up by the time I was diagnosed. So next generation sequencing looks at what the mutation in your cancer is. They could do a liquid biopsy or a tissue biopsy. Often patients diagnosed with lung cancer are so extremely ill that it's challenging to get enough tissue to run these samples. So now you have these liquid, it's a blood biopsy. So if you have stage 4 advanced cancer like that, I had plenty of circulating tumor to test, and I had very, very large amounts of the EGFR mutation. I also had several other mutations. So, this is critical information because this is a decision point on how to treat you. Chemotherapy is very ineffective against a lot of these mutations for lung cancer. But in the last 4 or 5 years, there's all of these new targeted therapies that are less toxic, allows you to have a great quality of life. Unfortunately, the cancer outsmarts them. So they work for a certain amount of time, but you're guaranteed that they're not going to last forever. The majority of people, it works between 9 and 18 months. I started having progression around 7 months. One thing I want to remind people is that when you're comparing costs, it's a lot quicker to get your blood drawn and be able to go home versus waiting till people are so sick. The cost of being in the hospital for 2 or 3 days is astronomical compared to a blood test. And yet we continue to fight our health insurance companies to cover the cost of the blood test. The blood test is around $1,500. I always ask my company, would you rather I be in the hospital for 3 days at a toll of $10,000 a day, or will you just reimburse for a blood test that is life-saving? So I ended up going to an NCI designated facility, and I've had this blood test done twice, and it's directed my care. So it's critical that people understand in lung cancer that this NGS test is part of your treatment plan. So when I met with my doctor, who is at UCSD, Dr. Bajanova, she said, tell me what you know about your cancer. So she was well prepared to respond to the research that I did. And she said, okay, then she wrote out all the mutations that they see in non-smoking women. She told me at what stage I was at and what, at this point, based on very recent research, what she recommended. And she felt that Tagrisso, along with some palliative radiation to help with the pain, would be my best option. So I started that September 18th of 2020. And I would say by the end of November, I started to feel almost 100% better. I skied last winter. I was able to ski and run and ride my bike. My daughter and I did a fundraiser for Padre Pedal, which involved a bike ride. So not only did it stop and halt my cancer, and I have stage 4 cancer, it allowed me to do all the things that I love to do. And that really matters to cancer patients. The experience, the pain and the suffering that I've seen over the 35 years as a nurse that cancer patients go through, it is so difficult to describe. Like I can tell you that my own child, when she was done with her, for 2 days would lay in her bed and shake as clumps of her hair came out, and crying and eyelashes falling out, and that was my own child. And so her life was absolutely put on hold. So I say to people, you can't imagine what it's like to suffer to that extent. And I can honestly tell you with these newer medications that it was nothing compared to what my own child went through. You know, I mean, I have bone pain, which has been significant, but I have lung cancer. I've never felt short of breath. I've never felt any respiratory symptoms at all. I've never coughed. I've never spit up blood. I don't have frequent respiratory. I had 0 symptoms. My only symptom was back pain. So although I feel so fortunate to have had this opportunity again, the urgency, you know, my daughter is 4 years out and she still has extreme fatigue. That's devastating to me. So I love the direction oncology is going in, but what I want to see is that the oncology community as a whole think about this paradigm shift. I mean, in 1 year, look at what we've discovered about COVID. We're how many years in the war against cancer? I think the most common and the side effect that I experienced was you get like an acneiform rash on your face and chest, a little bit in your hairline, and it's very itchy because you're inhibiting the epidermal growth factor. So your cells don't turn over and it's uncomfortable. If it was a few lesions at first and they did some topical antibiotics, but then when I really started to have a severe outbreak that became a little bit painful, they did use doxycycline. Not really for the antibiotic effect, but doxycycline has an anti-inflammatory effect. So I went on almost like a maintenance dose of an oral antibiotic, and I stayed on that for about 4 months. And, you know, it seemed to peak at about the 2-month, and I would say a couple months after that, I stayed on a very small dose, and it helped quite a bit. For the itching, my nurse practitioner, Jen, would give me Benadryl cream and some prednisone cream. You know, you have to avoid hot showers and be very consistent with your skincare. So you don't want to use things that have a lot of perfumes or that are heavy. So I use CeraVe, and I felt like my oncology team, my nurses, my nurse practitioner, they've learned through trial and error what works. There's so many people on these TKIs now. So they were pretty preventative once they saw that I was kind of going in that direction. Sure. So every few days you would get severe diarrhea with this medication, but I found it was fairly predictable. So on that day, like day 4, day 5, I stay a little closer to home and I make sure that I hydrated up and, made sure that I didn't eat anything that was too spicy or anything that was cramp me up. But I made sure I drank, definitely 32 to 60 ounces of water a day. That helped quite a bit. When you do have the diarrhea, it's so severe that you really do need to replace the electrolytes. So you don't want to have really sugary drinks like Gatorade. So I always had children's Pedialyte and I would just water it down. But for every time you go, you really need about 8 ounces of an electrolyte solution. When I started to have the progression, I had a PET scan so they could see that the tumor cells in my right upper lobe were active again. And I had a few more spots light up in my spine. So while we were looking for a clinical trial, my oncologist said, why don't we hit those spots? So I just had 5 doses directly to my right upper lobe and then to the 2 small spots on my spine. And that's when we started to decide what our next step would be. Standard of care right now is to go to chemotherapy, but my oncologist is very involved in lung cancer research. And she felt that because clinically I still was functioning very well, that I would be a good candidate for a trial. So in the lung cancer world, we know that there's no magic bullet right now. So when you're put on these targeted therapies, you're told by your oncologist, this is only going to work for a certain amount of time. So expect a scan at some point to show progression. So no one's really surprised by it. Unfortunately, we've seen these great strides made with Tagrisso. This is one of AstraZeneca's biggest drugs right now, but it's not a cure. It always stops working, always. So these clinical trials that are happening now in lung cancer are looking at how do you overcome the ozertinib resistance and get the ozertinib working again. Some people go on chemo and then back on Tagrisso. And what new drugs are out there, new combinations. So because I had an NGS test again after I started progressing, it still shows that my original mutation is still the dominating mutation. So I was looking at clinical trials that would still go after EGFR. This J&J trial was getting really good first feedback from the first few patients that were on it. So that was the one that she thought I would be best to go after. My oncologist works very closely with my clinical trial, Dr. Wu, who's at UC Irvine. When they didn't have a trial for me at UCSD, Dr. Bajanova called Dr. Wu. He said he would meet with me after he met with me and looked at my NGS testing. He thought I was a candidate. So I'm the first one at UC Irvine in this cohort. I go for the first 5 infusions, it's weekly. I take 3 tablets a day of the lazertinib, which is very similar to Tagrisso. And hopefully when I get my first scans, I'll show that there's a little bit of improvement. Dr. Wu does quite a bit of testing because it's a clinical trial. So every week that I go, I get quite an extensive amount of lab work. And I'm happy to report that my tumor burden decreased this week, which it means it's likely. I also developed the rash, but I'll take the rash if the tumor's going down. Yay to the greatest radiation team ever in San Diego. It's like even one good day is so valued, a day that I'm not in bed by 7 p.m. or, and, I've learned to do other things now. I'm reading so much more now because mostly fun for me is being out hiking or something, but you learn to adjust, and people say, well, is this quality of life? And I'm like, this is quality of life for me, being able to spend time with my family. I'm willing. And I know as a nurse and of all the friends and family I have, it's very personal what quality of life is for someone, but for me, this is quite tolerable. And I'm so, so grateful to be in this trial. They have found with the monoclonal antibody that the first infusion, people tend to have a reaction. I was given quite a few medications like Decadron and Benadryl and things to help, but I did get a reaction the first one, but it wasn't considered a high level reaction, and they responded quickly. And I've been weaned off the Decadron now. I'm tolerating it well. So the last week I didn't require it. And, that was just 2 days ago, and I'm feeling pretty good. So, I'm hopeful that there's no growth in my current tumors. And bone cancer is very painful. So I have had quite a bit of relief from my back pain, and that has been life-changing for me. I don't take anything for pain right now. So
Wow.
I like to, kind of judge if this treatment is working. And I would say my pain at the beginning of this 5 weeks ago would have been, moderate to severe, and now I'm pain-free. So that's a that's a win. Well, I think the takeaway is that research really does matter. And there are some cancers like lung cancer, like pancreatic cancer, like ovarian cancer, where we haven't seen the strides that we've seen in other cancers. Um, Again, I think people, when they think about cancer, it's just a club you never want to join, and that it can't happen to you. And I have been profoundly impacted by cancer. But there is a silver lining in the fact that it reminds you of what's important in life. And I would say that I make the most of every minute. I would say reach out to advocacy groups, because every cancer has them. And these are people who are so incredibly compassionate about finding a cure for these types, usually because of their own experience. So I know that I talk to Longevity and the Banya Daria Lung Cancer Foundation. I just recently started working with Lung Cancer Research Foundation and doing some work with them. Those are really where I found the best resources. And there's usually a patient education booklet. They have mentoring programs. I think you need that compassion and warmth when you're diagnosed with cancer, and that's my go-to.